This is the third Icons of Healthcare Summit, and it's really becoming such a fantastic place where the industry think tanks, they gather here to try to share their experiences.
We had 2 panel discussions and they were very good in technology because they were all focusing on technology.
Especially in terms of how to use the technology in healthcare to assist in terms of patient care and disease management.
Healthcare and technology goes hand in hand.
Technology to help you walk around, but at the end of the day, when you're sleeping on a bed, you need somebody to comfort you, that you know that somebody is there besides you.
Either disruptive innovation or disruptive technology. Wherever technology comes in, there is always disruption.
Across all countries, in all settings, because the cost of care is going up, right? I mean, and then that puts pressure either on the payer, right, which could be the national insurance, so healthcare system, or even in private insurance itself. And the fact that it's happening because now Singapore government has basically says that you can't buy insurance with full rider anymore, right? So I think that's definitely a movement. I mean, it is a starting of a journey, but it's a long journey. It's moving to a value-based healthcare.
Really learn different interesting apps and then different terminologies which has been used in healthcare industries and how it is helping the healthcare consumers, the users as an end product.
Healthcare as a sector has a huge degree of inefficiency. And most of those inefficiency which is currently carried by human beings can be easily replaced or enhanced by machine, be it the back-end support or be it the front-end of very advanced layer of the AI. But on top of that, anything that has a degree of pattern recognition, those pattern recognition can be done so much more at scale by machine than any human being, So I would say most of the push of AI and things of the related of that will come into that domain. Where there is an expertise model attached with a human intervention, that is where AI will work best with a human being rather than on a standalone basis.
Health is for all, anytime, anywhere. So we are spreading these 50 virtual clinics which we have started off with all the corporate centers, the diagnostics and the ICU. We plan to put in another 100 more virtual clinics.
The structure of the whole program was good and then the topics were good.
The fact is, having a machine to help refine the ability to do diagnoses makes a lot of sense. I don't think we're going to see a situation where complex medical conditions are going to be solved by a machine in my lifetime. I just don't see that's possible. I think the technology will be there, but the actual acceptance is going to be challenging.
And basically learn from all the different things that are happening within the industry, to help myself grow, to help the team grow, and to help develop new ideas and new thought processes as well.
In the last 20 years with the industry, one thing that has really struck me is that beyond all of that hype about multi-billion-dollar drugs and blockbuster drugs as they call it, there's really a lot more behind healthcare than drugs. Drugs is just one small part of all of the expenses and resources and efforts that we put into taking care of people and ourselves. And I believe that for all of us, what really strikes closer to home, to all of us in this room, is that sooner or later, we ourselves or a loved one is going to become a patient that you have to care for. We're all going to become caregivers in our own right. What it needs to happen from a policy perspective, and first let me start with survey after survey, all of the research shows this is what patients want. So when we talk about patient-centered care, they really want to be in the community. They want to be at home, especially older people. They don't want to be in the hospital. So how can we enable that to happen? And I think from a policy perspective, a big approach is going to be how we pay for it. So it's going to be as potentially governments, and if we see also insurance companies start to become more creative, and maybe for even us as individuals being willing to pay more for insurance, but looking at all the different payment mechanisms other than out-of-pocket for people to move more towards community-based care, and then we'll see this start to become more prominent.
This is the first time that I attended the Icons in Healthcare Summit. I must say that the panels were very very knowledgeable in the areas that we are talking about, and I found the discussion very interesting, and it gave different perspectives of things, you know, from the providers of technology and from the perspective of the patients.
We typically, when we talk about long-term care, we typically think about their life, how their lives would be, the activities of daily living, but actually there's a lot of actually the main question we should be asking is, what's the major shift that we are seeing between the people, the ages of the past 30 years versus the next 30 years?
One of the things that I would like to share with all of you is a stat, particularly in a local nursing home in Singapore, one of our customers who actually got a National Health IT Award last year. They went from a no system to a system-based administration of their operations. Their medication administration productivity improvement was 57%. The invoicing bill generation was 62%. The referral of patients was 70%, and the ILTC system, which is what we report against and to the Agency of Integrated Care in Singapore, there they saw a 52% improvement in productivity. We are big fans as we make software for these elder care and long-term care operators. We are big fans of generating productivity, not just in Singapore. Napier is present today in 3 continents in about 9 countries.
We have a big message to the people of Singapore, and that's that you actually can live a healthy life. And we like to think that we provide a framework that people can live to help them get on that healthy path.
Today, whatever sessions I've gone through, a lot of interaction, a lot of information has come to us. And this is the way I think we get to meet more people. Otherwise, with a busy schedule of being a doctor, I don't think I really, take out time to interact. And this platform is really excellent.
We've met some really important people, some people that are doing some amazing things. I was hoping and praying that we would get 1 award, but having 2 was one of the most exciting feelings for any young entrepreneur, somebody trying hard to build an exciting function from scratch. It's a big honor, it's a big privilege to be able to get 2 awards.
This is really an honor for me to receive this award.
It's very nice to be recognized, and especially working in a rural kind of a situation.
Actually, this award is not from me, but it's for my whole team, my hospital and my country also.
It's something which I share my life.
Actually, for these icons of healthcare is very familiar to me, because this is the 3rd year that I'm attending this function.
We have received the award from the Icons of Healthcare Award.
Thank you so much, BERG Singapore and Icons of Healthcare.
Thank you very much. I'm very, very honored to be here today.
Thank you. Thank you very much.
Thank you so much.
It feels good.
I'm super excited. It's a very joyful moment for me.
We welcome you to Malaysia, experience Malaysia healthcare, embrace Malaysian hospitality.
And I think the people appreciated it very much. The structure of the whole program was good, and then the topics were good, particularly on technology and healthcare. We are very happy about it.
Thank you so much for joining us this evening.
Thank you.
I'm delighted to be here, and we'll see you next year.